As for the issues they face, I think definitely there's some psychosocial issues. Mentally, I can't imagine knowing that you have lung cancer because of how much pain, and honestly, the survival rate being so low. I know that it pretty much said 5-year survival rate is like 15%. And then if it's like metastasized already and moved throughout the body, it's more like a 5% survival rate. Basically, these people are diagnosed by possibly lab tests, imaging, or biopsy. I know when I did a rotation out west, a lady was having bloody sputum, and so the PA I was with said that obviously lung cancer was one of the things that we were going to have to check her for. So that bloody sputum, she also had a cough. They can be fatigued, in a lot of pain, shortness of breath, or chest pain. And sometimes when those things come up, then that means that they're going to look more into trying to diagnose that. As for treatment, if it is not advanced, they may try just chemo and radiation. If it's more advanced and serious, then they may go with surgery. That can be removing part of a lung, all of a lung, depending on where the cancer's at, how much it's spread. And then usually after surgery, they continue with chemo and radiation again. Smoking's obviously the #1 cause. We know now that there's information showing the relationship between secondhand smoke as well. The 3 types are non-small cell, which is the most common; small cell, which is the one that spreads fast and kind of hides itself within our regular tissues, and it's the most common cancer for us. Obviously, early detection is the key, which is kind of how it is with all of us. People who have treatment, sometimes it can be 6 to 12 months life expectancy, versus no treatment can be as little as 2 to 4 months. So I think that is pretty much it. And then I know that they're working on a lot of research because it is so prevalent within the US, and trying to figure out ways that we can combat this.